Hi everyone, in the video I will go through with you about the new blog post that I've posted on pharmacological treatment of arrhythmia. Um, as you can see, I've placed some keywords that can help you look for the article online. I've placed some highlights, which are basically the most important key bits from the article. In Clinician's Corner, as you can observe, there are some more complicated terms that can be not understandable for everyone because they aimed to clinicians, healthcare professionals, and another scientists. So let's go to the abstract in which basically is a summary of the whole blog. So I guess that if you're very in a rush, you can just read the abstract to kind of have an overview on what's going to happen. So it starts with importance of pharmacological treatment of arrhythmia. Is basically means that arrhythmia is a cardiac disorder that is causing your heartbeat to be either too slow, which could be below 60 beats per minute, or too fast, which would be above 100 beats per minute. And it is very important to treat all types of arrhythmia with appropriate medications, as there are huge numbers of people that are being affected, which is 2 million people in UK, and there's 100,000 people dying from it each year, which is a huge, huge number, especially with the fact that if it's diagnosed correctly and if it's treated efficiently, then the patient can live happily and long life. It can be, it is manageable condition. However, in some cases, obviously the cases from the numbers, people are dying from it. So also there's the thing that arrhythmias can cause another underlying condition such as COPD, which is chronic obstructive pulmonary disorder, which is affecting your lungs. So the classification of arrhythmias is done based on the type of the difference in a heartbeat they're causing, and they can be diagnosed with electrocardiograms and Doppler devices in cardio clinics. So there are different types, including AF and AFL and SSS. Then we go to ST, AA, and VF. On the figure 1, you can observe the basic heart rhythm that happens in a healthy heart. So we've got a Q, R, S complex, and then we go to ST segment. So in different types of arrhythmia, those lines would go either very steep or very flat, or they could also go a bit lower than usual. So it's all those alterations that we're looking at. So the medications that are treating arrhythmias are divided into classes. And we've got class 1A, 1B, 1C, 2, 3, and 4. So different classes of medications are affecting different types of disorder, as you can see. So for example, type class 3 is increasing the QRS duration, which is um, very useful in arrhythmias such as supraventricular and ventricular arrhythmia. So the medication from type 3, class 3, sorry, is amiodarone, and amiodarone is type 3 agent. The another medications that I've covered is flaconide, ibutylide, lidocaine, which probably a lot of you have heard about. There we've got a comparisons between amiodarone and lidocaine. We're also talking in the blog on procainamide, propafenone, quinidine, and then I'm talking about the recent findings and the side effects of those medications, such as that thing, which is which basically is twisting the pigs from ECG image as we've seen before, and it causing them to look like tornado. And in concluding remarks, I would like to focus on the fact that those are definitely the things to be looking at in the future when we're talking about pharmacological treatment. Thank you.